Hello, my name is Dr. Bethany Murray. I'm a faculty member at the Indiana University School of Medicine on the campus in Bloomington, Indiana. Today I'm going to be speaking with you about draping and positioning your patient for the physical exam. So first things first, in this era of coronavirus, we would typically be wearing a mask for all of our patient encounters. I have chosen to take my mask off for this demonstration video. Additionally, you will want to wear gloves for any patient encounters, including peer practice or standardized patients. Always use hand sanitizer or wash your hands before applying gloves, and then after you take your gloves off, you want to wash your hands once again. Okay, now, am I ready to begin? Well, let's look at a couple of things about my presentation. My hair is a little long, so when I lean over this patient, my hair is going to fall forward. This may be uncomfortable for the patient, and it may also create some infectious disease risk. So I'm going to pull my hair back into a ponytail at the nape of the neck. If you have hair longer than, say, chin length, you will need to secure your hair for any patient care activities. Likewise, I like to wear my stethoscope around my neck. However, when I bend over a patient to do any kind of exam maneuvers, this may fall onto the patient and create a safety or comfort hazard. So I'm going to go ahead and take my stethoscope off and lay it beside the bed on this table. It's still handy and I can get to it quickly. Am I ready? Well, you may notice that I also am wearing long earrings. They were hidden by my hair when it was down, but now that my hair is up, they're a lot more obvious. This can create a safety hazard for myself. If your patient is confused or flailing about, they may grab at you and get their finger caught in the earrings. So it's important to not have anything more than a very short hoop or stud earring. So I'll just take those off and pop them in my pocket. Okay, now I'm almost ready to start. The next thing I want to point out is the positioning and height of the bed. In this case, we're using a hospital bed with our patient. You may also be doing examinations with cots or with exam tables. Exam room tables have an extender at the foot that you need to pull out to support your patient's legs. Never let a patient have their legs dangling off the end of the exam table bed. The height of the bed is a little uncomfortable for me. If I'm going to spend some time bent over this person doing a physical exam, I will very quickly develop a backache. So I'm going to go ahead and raise the head of the bed up to a height that's comfortable to me. Okay, that's pretty good. The taller you are, the higher you're going to need the bed. Now remember, before you leave the room, this bed needs to go back down to its lowest setting for patient safety. All right? Many patients can't tolerate lying flat on their back. So you also want to go ahead and increase the head of the bed to about 30 degrees. This is both for patient comfort and also 30 degrees is the acceptable position for the Indiana University School of Medicine physical examination. This gives you better findings when you're visualizing the jugular veins for distension, and you should always remember to set the head of your bed at 30 degrees. Okay. Lastly, this side rail is somewhat of a hindrance or barrier for my physical exam. So I'm going to go ahead and lower the side rail and give me better access. Great. Again, when you leave the patient, please remember to put that side rail back up so that it doesn't create a safety hazard for your patient. All right, this is Mr. John Smith. He is simulating an unconscious or bedridden patient for us today. If you are working with a conscious patient, you will start your physical exam with the patient most likely sitting at the side of the bed, as long as that's not medically contraindicated, and then you'll move to having them lie down in the bed, adjust the head to 30 degrees, and make sure that the foot of the bed on an exam table is properly set. Mr. Johnson, I'm going to do a physical exam. Is that okay with you? And we're going to assume that he's given his consent. Always ask permission. Now, the 4 principles for draping and positioning your patient are privacy, modesty, comfort, and safety. So let's keep that in mind. We want the patient to maintain their privacy and modesty. We want them to be comfortable or not cold, and also we want them to be safe. To examine the top portion of the body, the shoulders, clavicles, the neck, just lower your blanket down a little bit, and if the gown is tied, you can untie that, and if this Shoulders are snapped. You want to go ahead and unsnap the shoulders and lower that down to about the area of the clavicles. Okay. Now we can easily inspect the neck, palpate the carotids, inspect the jugular vein, and look at the upper part of the shoulders. Okay. Always do your physical exam from the patient's right side. So if you're facing the bed, it's your left hand, but from the patient's perspective, it's the right side. This is the standard positioning for doing your physical exam maneuvers. You will move around the bed to examine different body parts, but your default position is on the patient's right side. Now that we've examined the shoulders, we're going to raise this gown back up and use the gown itself as a blanket. You may also get another blanket if your patient is particularly cold and feels like the air temperature is uncomfortable. But in this case, Mr. Smith is just fine with just using his gown as a blanket. So Mr. Smith, I'm now going to examine your heart and your lungs in the front. Okay, so I'm going to lower your blanket down just about to the costal margin of the rib cage or the upper abdomen. And then I'm going to reach up under and just pull his gown up to around his neck. Okay, so you can see that this positioning just exposes a small rectangle of skin for the upper chest wall. Now I can easily inspect the chest for any deformities or abnormal movements, expansion of the lungs, signs of cardiac problems. I can palpate the chest. I can percuss the lungs. I can auscultate the heart and lungs and all of the things that I need to do. It's very important that you do your heart and lung exam and all of your examination maneuvers over bare skin. In this case, for standardized patients and for peer practice, your patient will be wearing a sports bra or a tank top. Male patients may feel comfortable removing their shirt, and that's okay. But we always want to remember to try to do all of our exam maneuvers over bare skin so we don't interfere with the findings or mask any findings. Now that we've finished the upper chest exam, we'll move on to draping for the abdominal exam. So we're going to lower your cover back down and stop at about the costal margin. And then we're going to lower this blanket to the suprapubic region. We don't need to expose the pelvis to do an abdominal exam. We just need this small rectangle. Now, something that may be important is to elevate the patient's knees at this point. Abdominal exams can be very ticklish and uncomfortable for a patient, so elevating the knees of the bed or exam table can provide a little bit of softening of those abdominal muscles to make the exam more comfortable. Now we've exposed the rectangle of abdomen that we need to inspect. We'll need to percuss, auscultate with the stethoscope, and lastly, palpate. When palpating the liver, we'll stand on the right side of the patient with the left hand under the rib cage for support and palpate the liver. Then we'll reach across, support the rib cage on the left side of the patient, and palpate for the spleen. Okay. Now, in Foundations of Clinical Practice 1, or first year of medical school, we don't do a pelvic exam. However, in your clinical settings, you may sometimes assist with Foley catheters or peritoneal care, and the proper draping for a peritoneal or pelvic exam is to raise the blanket up just to the pubic region. Then if you have an exam table with stirrups, you may need to put the patient's feet into stirrups. Otherwise, you can just simply bend the legs like this and perform the procedures that you need to perform. When finished, assist the patient in lowering their legs and cover them back up. Okay, now let's talk about extremities. You will need to expose extremities to do range of motion and musculoskeletal exams, to do circulatory and peripheral vascular exams, to do neurological exams. But let's remember the principles of privacy, modesty, comfort, and safety. Let's expose one extremity at a time. So tuck your blanket in, and now we've exposed the upper arm for all of the maneuvers we may need to do. Before moving on, let's cover that back up. and expose the opposite side. Okay. Now, so move on to the lower extremities. Tuck that blanket in, and now you can inspect, do range of motion, check reflexes, all of the procedures that you need to do for the lower extremity, and then, of course, repeat that on the other side. Okay, we've almost finished our physical exam. We do have the challenge, however, with a bedridden or unconscious patient of examining their posterior body. So we need to access the upper back in order to assess lung sounds and the functioning of the respiratory system. And it's a good idea to also do an examination of the patient's coccyx and areas that might be particularly prone to ulcerations from pressure on the bed. So the first thing you want to do when you're going to roll your patient over to inspect their back is put your side rail back up. You don't want that person rolling off onto you and onto the ground. Make sure the arm closest to you is straight and flat. And then let's bring the arm away from you across the patient's body. Similarly, in the patient's leg away from you up as far as they can comfortably tolerate. And then with your right hand on the patient's knee and your left hand on their shoulder, you just gently roll them over. And you can scoot back a little bit, and they should be able to hold that position. If the patient is a bit conscious or able to help, have them grab a hold of the side rail for you. Okay? Obviously, it's better and safer if you can do this with a partner. Then one person can hold the patient safely over while you move around to the other side of the bed and do the posterior inspection, palpation, percussion, and auscultation of the lungs. And then you can pull the blanket down to inspect the coccyx area to see if you have any pressure sores developing. Okay, and cover that back up. All right, so we're ready to roll Mr. Smith back over. Let's make sure there's no wrinkles, fabric, IV lines, any tubing that might get in his way, and then just gently roll him back onto his back, not letting him flop. Lower his leg back down, tuck his arm back under. You can reach under the shoulders a little bit, and there we go. So these are the basics of draping and positioning your patient for the physical exam. As you leave the room, don't forget to assist your patient in re-snapping or reattaching the hospital gown, and make sure the side rails are both firmly up for safety. And lastly, go ahead and lower that bed all the way back down to a safe position. Thank you very much, and I hope that this video has helped you to understand the process of draping and positioning your patient for privacy, modesty, comfort, and safety. Bye-bye.